Good evening, Matt Wordsworth with ABC News. We have encouraging news tonight. Queensland has recorded just 2 new locally acquired cases of COVID-19 in the past 24 hours. They are a nurse and her housemate. Crucially, they're linked to existing infections stemming from the Princess Alexandra Hospital. This nurse is now the 3rd medical staffer to acquire the virus at the hospital, raising serious contamination concerns. More than 1,000 people are now in quarantine because of 2 clusters. The Blues Fest in Byron Bay was cancelled late this afternoon, but authorities here are heartened by the huge numbers of people getting tested. And with Easter in just a few days, millions of southeast Queenslanders are waiting to find out if their holidays can go ahead or they're cancelled. Jessica Van Vonderen begins our coverage.
In homes around Greater Brisbane, people are packing and hoping COVID won't ruin their Easter holiday plans.
I'm kind of half packed, but then not completely. I figured I'd just do what I can.
The Mars are planning a Fraser Island getaway.
We all like going to the beach surfing.
Today we have some very encouraging news.
Just 2 new community infections were picked up overnight. One is a nurse who works at the PA hospital, the other her housemate. She has the same strain as a patient who returned from India. He was admitted to the infectious diseases ward at 8:30 p.m. on the 23rd of March. The nurse, who had been vaccinated, began her shift at 10 p.m, but never had direct contact with him.
Which means that there is most likely some environmental contamination or some aerosolisation of the virus when the person was admitted.
The ward has been closed and cleaned. In total, there are now 11 people in that cluster, including another PA hospital nurse and the Hens Party, which travelled to Byron Bay in northern New South Wales. Authorities there are now imposing restrictions after a man in his 20s tested positive, having visited the Byron Beach Hotel at the same time as the women from Queensland.
There's probably more to come over the next few days. I think we'd be pretty naive to think otherwise.
A separate cluster involving a PA hospital doctor stands at 8 after testing revealed 2 suspect cases were in fact negative. While Brisbane streets remain relatively quiet, queues continue at testing clinics. More than 33,000 people were swabbed yesterday.
That is a massive number.
So I thank every single one of the people who came forward yesterday and got themselves tested. That has been critical.
The Health Minister among them.
She has a sore throat, so she's gone to get a COVID test. So the Health Minister is following exactly her own advice.
Most are following the Queensland-wide mask mandate too. 9 a.m. tomorrow is when we find out if the lockdown can be lifted. It all depends on the number of new infections and if they can be linked to the existing clusters. Tourism operators and families are holding their breath and crossing their fingers.
If we see very good testing rates across Queensland and we don't see any unlinked community transmission, the signs for Easter are looking positive.
Jessica Van Vonderen, ABC News.
So there's a lot at stake when they weigh up that decision tomorrow. So let's go live to the streets of lockdown Brisbane and reporter Lily Nothling, who joins us from South Bank. Lily, how's the atmosphere there tonight?
Matt, there's certainly a lot more optimism here than there was yesterday with just those 2 new locally acquired cases. Here in South Bank, things would usually be packed with people overflowing these restaurants, bars and the nearby parklands, and it's hoped they will be able to return soon. But it is an anxious wait for the millions of residents across Greater Brisbane to see whether those lockdown orders will be lifted as planned tomorrow night. And it's not just holiday makers who are invested. The businesses here who would usually be busy are hoping to salvage the usually busy Easter period. Churches too are preparing for the possibility they may have to live stream their Easter services if lockdown orders are extended. Now, in the past couple of hours, Queensland Health has added a number of new contact tracing locations to its website. It includes the Hamilton Hotel, Sports Bar and Pokies Room. Anyone who was there last Tuesday afternoon, the 23rd of March, is being ordered into isolation for 14 days. But really, all eyes will be on that case tally tomorrow morning. We're expecting an update from health authorities about the future of lockdown at 9 a.m. Matt?
Thank you, Lily. Lily Nothling at South Bank. A war of words has erupted over the vaccine rollout after federal ministers criticised the states for doing bugger all and stockpiling doses. The Queensland government has hit back, calling on the Commonwealth to give more clarity around vaccine supply and delivery. Here's state political reporter Rachel Rieger.
It was unveiled with flourish. Australia would aim for 4 million people to receive a COVID vaccination by the end of March.
That is a target. That is what we are working to.
The Commonwealth tempered those expectations due to overseas supply issues, but still it's fallen well short of the original goal, with only 670,000 doses administered nationally, a shortfall of 3.3 million. Federal MPs have been quick to blame the states and territories for the sluggish pace.
We're going to help the states, but they've got to admit they've got a problem because they've done 3/5 of bugger all. There's one lousy job they've got to do, and that's just starting to put jabs into people's arms, and they've been asleep at the wheel.
And say once again to the states and territories, second dose is there, is available, so please roll out those stockpiles.
The states came out swinging, claiming there's no certainty of vaccine supply from the government.
No, we are not stockpiling vaccines. We need to have guarantee supply, and we need to have guaranteed times of delivery.
I will not have untrue statements made publicly. What is also extremely unfair is that when we are given 24 or 48 hours notice about how many new doses we're getting.
I really find this very offensive. I mean, this is the first time you'll find that I've said anything negative publicly in 15 months, but I'm angry.
Queensland's Deputy Premier wants the federal government to release the number of vaccines being administered each day.
Every time the Morrison government wants to deflect from their failings, they launch an attack on the states and territories.
Scott Morrison says the states get a 12-week plan for vaccine distribution. He also says his government is aiming for everyone to receive a jab by October.
Not interested in people who want to play politics with vaccines and distribution and all of that sort of thing.
Almost all of the state's 1A group, which includes frontline health and quarantine workers, have been vaccinated, with the focus now moving to 1B, which includes more than 1 million high-risk adults. The state's chief health officer says rollout delays across Australia have been caused by supply issues with Europe, and that will change once local production of the AstraZeneca vaccine ramps up.
We are doing this as collaboratively as we possibly can.
Almost 72,000 vaccines have been administered in Queensland since the rollout began. Rachel Rieger, ABC News, Brisbane.
So let's take a look at where we're up to in the vaccine rollout. With fewer than 700,000 doses administered, Australia is nowhere near the original goal of 4 million doses by today. But that already ambitious target became impossible once overseas supplies dried up. The government says we only got 18% of the AstraZeneca supplies we were expecting to import. There aren't even 4 million doses in the country yet. We're now seeing an average of nearly 50,000 doses a day, and that's growing. That's still well short of what's needed for everyone to be vaccinated by October, or at least the revised goal of everyone getting first doses by then. Even that would require well over 140,000 doses a day.